it.
According to the American Diabetes Association, nearly 21 million Americans have the disease right now. Yet a third of them are unaware they have it. Experts say a big part of the problem is patients go into denial when symptoms occur.
We think that when we're tired, there's just because we're working too hard. We think that when we're, we're waking up in the middle of the night to urinate. I probably just had a little bit too much liquids to drink in the evening. But yet, you didn't wake up in the middle of the night last year and 2 years ago. So there's a tendency to not run to see your healthcare professional.
And that, Dr. Cohen says, is a huge mistake. Complications from unchecked diabetes can be deadly. Dr. Cohen also says treatment of diabetes, the only major U.S. disease with a climbing death rate, is now costing the federal government more than AIDS has ever cost. So it's time to stem the tide, and an understanding of the disease will go a long way in doing just that. First off, just what is diabetes? It's a disease in which the body does not produce or properly use insulin, a hormone needed to convert sugar, starches, and other food into energy. The disease can actually manifest itself in different ways.
There is gestational diabetes, which means diabetes that you develop just during the pregnancy, then it goes away. There is type 1 diabetes, where somebody's not making insulin at all. And then there's type 2 diabetes.
Type 1 diabetes used to be called juvenile onset diabetes, and type 2 adult onset. But that's changed because doctors realize that either type can affect anyone at any age. To help understand the difference between type 1 and type 2, it's helpful to think of insulin as a key to a door. In this case, though, the door is your cell, and the key unlocks the door to let in glucose and other energy sources that your body needs to keep going.
Type 1 diabetes is a disorder in which you don't make the key, you don't make insulin. So it's hard to open the door of your cells to get nutrition into the cells. In type 2 diabetes, you make the key initially, but when the keyhole is stuck, it's hard for that key of insulin to open the door, and it's harder and harder. You make more insulin to try to open the door, but eventually you can't make it open, so that insulin decreases and the diabetes occurs.
A diagnosis of any disease can be a difficult challenge, but especially so for children. Carrie Curran recalls her first thought when she was told she had type 1 diabetes.
Absolutely shocking. You're 13 years old, terrified of needles. I felt like my life was over.
In fact, the next phase of Carrie's life was just getting started. Critical to her control of the disease was strong family support and a crash course in diabetes management.
The hospital was wonderful. They had people who came in who trained us, nurses and doctors in every couple of hours. We watched videos, we went to classes.
Type 1 diabetics like Carrie work to keep their blood sugar as near to normal as possible. Frequent testing of blood glucose levels and administering insulin shots help maintain the desired levels, so sticking to a rigid schedule is necessary. At least it used to be. Thanks to this little device, diabetes patients have a lot more freedom than in the past.
A lot of those patients are using now what we call insulin pumps. Those are devices which can give insulin on a continual basis, which means we can see what our blood sugar is, see how much insulin we want to give, and just touch a button and give insulin depending on when we need to give it, before meals, exercise, snacks, etc.
You don't feel like you're hooked up to something 24 hours a day like I thought you would. I think I'm a happier person. I don't have to constantly be stressed about my blood sugar.
The insulin pump not only gave Carrie a measure of freedom back, it also helped her adjust to the challenge of pregnancy and the delivery of little Callie.
I cannot imagine going through pregnancy without the pump. With pregnancy and the hormones that are in your body, it's an up-down event every day with blood sugars, and I was able to adjust and meet the needs of pregnancy so much better with the pump. It was still a struggle, and it was still a long 9 months, but she was healthy, and that was my biggest concern, and that enabled me to get through pregnancy and have her be healthy.
So blood glucose monitoring and blood glucose reductions by giving insulin in a very fine-tuned fashion is not just a pie-in-the-sky future thing. It's in the here and now.
Something else in the here and now, inhaled insulin. The Food and Drug Administration recently approved Exubera, the first inhaled and non-injectable insulin in the United States. tools like the insulin inhaler and the insulin pump are a welcome relief for type 1 diabetics who need to manage the disease. For the majority of those headed for type 2 diabetes, experts like Dr. Cohen are stressing education and lifestyle changes in an effort to prevent the disease.
We've had an explosion in the number of people with significant obesity in the United States. And what we're seeing is as the increased incidence of obesity occurs, the increased incidence of diabetes follows right behind it. And it's the type of thing that you really want to change your behavior. You want to change food behavior. You want to change exercise behavior. You want to make those higher up in your chain of important things to do.
By taking steps to prevent diabetes, or by sticking to your commitment to manage it, you'll go a long way in avoiding problems down the road.
You can do it. It takes commitment, it takes work, but you can do it. And I think I lead a completely normal lifestyle. I mean, as normal as it can be with a 7-month-old, but life is normal and good.
For Smart Medicine, I'm Rod Starnes.
Joining me now is research nurse Lily Rutledge. Nurse Rutledge, thanks so much for joining us.
Thank you for having me.
Tell me about some of the latest drugs or technologies that are being studied right now that could help with diabetes.
Well, there's some new drugs coming out that work through your gastrointestinal system. They're enzyme blocking agents that help lower your blood sugar and are treated that way in a different, aspect of the physiology of it.
Are there more technologies or drugs in development that would treat type 1 or type 2 diabetes?
Well, there's several different drugs out there that they're about to market that you use in combination with other oral diabetes medications that would potentiate or enhance its use.
Is there anything in the works that would cure diabetes altogether?
There's one treatment where you can treat with immunosuppressants if someone is at that stage. It's usually called the honeymoon stage, when you exhibit symptoms of maybe developing diabetes. You can go ahead and try to prevent more beta cell destruction. The beta cells are in your pancreas and they produce insulin. So if you save that deterioration, you can sort of preserve the ability to produce the insulin.
And that would be with type 1 diabetes, and generally when it's at the very beginning stage, basically in children?
Yeah, in the stage with children sometimes.
Well, thanks so much for joining us.